from the station that's on your side. This is Channel 7 News at 10.
Well, most of us are heading to bed soon, but the question is, will we get a good night's sleep?
22 million Americans will not because of sleep apnea. Alicia Dover here now with why a simple sleep study could save your life. And Alicia, it's even easier to have one done now, right?
Well, that's right. And get this, 75% of those with sleep apnea don't even know they have it. But a sleep study can now be done from the comfort of your own home, right from your own bed.
For millions of Americans, a battle is waging for their health, and they're not even awake to see it happen. Sleep apnea is a medical condition where a person stops breathing multiple times a night. It's often undiagnosed simply because the victim is deep in slumber. Just take a look at this YouTube video shot by a wife whose husband and even doctors didn't believe just how long he stopped breathing in the middle of the night. In fact, each person we interviewed had the same story.
My husband, Joe.
My wife's urging. Most of all for my wife.
Baptist Hospital doctor Jason Williams says that's why most patients come in.
Sometimes their bed partner will sometimes dictate whether they present to the clinic or not.
While the restless nights might be an annoyance, it could end up becoming life-threatening. Untreated sleep apnea comes with dangers to the heart.
Difficulty to keep the blood pressure under good control, maybe increased risk of hypertension. Increased risk of ischemic heart disease, heart attacks, stroke risk may go up, irregular heart rhythms, atrial fibrillation is a common one.
Going untreated also brings side effects to the brain.
Mood disorders, not being able to focus well, not being able to concentrate, job performance may decrease, may start to have problems with their short-term memory.
Clarity of mind is exactly why Jeff Bryant, who works in IT, came in for a study.
Requires, being able to be sharp mentally, and I think a good night's sleep is, key to that.
Bryant will undergo a study at home, a newer option for Baptist patients.
It helped make my decision a little easier because it's not a strange place. It's not sleep in a sterile room, a hospital room or something.
Casey Phillips says doing the study from home allowed him to rest easier.
At home, first of all, you're there, you're in your own bed, under normal conditions, you're doing everything like you would normally do. You don't feel like you're being watched.
He stops breathing about 16 times a night, but Phillips says his CPAP machine is comfortable to wear and small enough to travel with for work.
It's pushing that positive pressure in my nose as I'm breathing, and when I stop, it keeps pushing air in there.
Dr. Williams says the big, bulky CPAP machines are being phased out.
They've gotten to be a lot more comfortable, a lot smaller. Some of them just have little tips inside the nose.
While Phillips and Bryant did their sleep studies at home, Clarissa Coleman did hers inside of Baptist Sleep Lab. At the time, she was able to sleep anywhere, even places she wasn't supposed to.
I was going to sleep in movies, and this is real terrible. I played piano one time, I wasn't playing. I went to sleep in church. I sure did. So I knew it was serious.
Coleman says doctors discovered some serious underlying health issues, many of which have been helped because her severe sleep apnea was caught.
A lot of times people say what you don't know won't hurt you. That I don't agree with that. The overall thing is you want to get better and you want to be able to sleep well.
And these CPAP machines are so smart now, they even have digital cards in them, much like a cell phone that connects right to Baptist Sleep Program. They monitor things and notice problems at any time. Beth?
All right, convenient, very interesting too, Alicia. Thanks a lot. And we'll have a link to the Baptist Health Sleep Center on our website, katv.com.